Afternoon, Dr. Yu. My name is RASYIDAH binti ALIFF. My partner is VALARMATHY RAJAMANIKAM. So we are going to present our mini project, which is the title Plasmodium Falciparum. For the presentation part, I will present the introduction, epidemiology, mode of transmission, life cycle, and prevention, while Madi will present taxonomy, symptom diagnosis, treatment, complication, and conclusion. For the introduction of Plasmodium falciparum, Plasmodium falciparum is a protozoan parasite, which is one of the species of Plasmodium that cause malaria in human. It is transmitted by the female Anopheles mosquito, and malaria caused by the species of falciparum is the most dangerous form of malaria with the highest rate of complication and mortality. So there are 5 types of parasite species that cause malaria, and two of the species that are more life-threatening is Plasmodium falciparum and Plasmodium vivax. Next.
Taxonomy classification, phylum Epicomplexa, class RASYIDAH, and order Hemosporidae, family Plasmodium, and genus Plasmodium, and species Plasmodium falciparum.
The epidemiology of malaria in Malaysia. Secondary data was reviewed from the Ministry of Health regarding reported of malaria confirmed cases from January 2015 to December 2017. So a total of 16,500 malaria cases was notified in Malaysia, and many contribute from Sabah, which is 43%, and Sarawak 34.4%, and majority of male, which is 82%. Knowlesi was the commonest species in Sabah and Sarawak, which is 77.1%, while there were more Plasmodium vivax cases, which is 42.2% in Peninsular Malaysia. Sarawak reported the highest average incident rate, followed by Sabah, and other states in Peninsular Malaysia reported below the national average. Next. The mode of transmission of Plasmodium falciparum protozoa. It begins when the infected mosquito bites the person and infect the human liver, then causing the infection in the red blood cell. And then the cycle will rotate again. Next. The life cycle of Plasmodium falciparum is classified into two in the mosquito and human. In mosquito, where the mosquito will produce the gamete into zygote, into eukaryotes and oocytes, and then oocytes will release sporozoites. Sporozoites will release in the human liver and causing infection in red blood cell. So the infection will go through a cycle called asexual blood stages, where the sporozoite will release from the liver, infect the red blood cell, and then causing a formation of ring in the red blood cell, and then turn into schizon, and the schizon will be ruptured and infect the other red blood cell. And then the infected red blood cell will also produce gametes in the mosquito. And next. Based on this diagram, there are 2 stages, which is infective and diagnostic stage. Infective stage begin when the mosquito bite the human, and then the human get infected. The liver cell will become infected and affect the red blood cell, and then the red blood cell will go through erythrocytic cycle, and through this stage is the diagnostic stage. And the picture next to it is just a reference where we can spot 2 rings of formation is the nucleus, where the diagnostic stage can be made. And the last, at the below one is the tropozoid and the schizoid. Next.
The most common symptom of Plasmodium falciparum is fever. There is still stage, cold stage is 1 hour, hot stage 6 hours, and sweating stage is 4 hours. Other than that, having headache, nausea and vomiting, muscle pain, cough, abdominal pain, and diarrhea. Diagnosis is serology help rule out fever of unknown origin. Gene and DNA probes too slow and costly, especially in the field. Stained fixed blood smear is a two type, is a thick film detect organism and present and absent. Or thin film is to identify the species and also see the morphology of red blood cell. Blood film collect from free following fingertips, capillary fluorescent, antigen and polymerase chain reaction. The image shows the example of peripheral blood smear of Plasmodium falciparum. The first picture shows the rings double chromatin dots and gametocytes is a mature and also thrombozoid compact. The treatment for adult intravenous or intramuscular artesunate is recommended. Quinine is an acceptable alternative if parenteral artesunate is not available. For children, especially in the malaria endemic area of Africa, artesunate intravascular or intramuscular quinine, intravascular infusion or divided intramuscular injection, and artemether intramuscular are recommended. Parenteral anti-malaria should be administered for minimum 24 hours because of ability to tolerate oral medication earlier. And also complete treatment is recommended, including a complete course of ACT or 18 plus clindamycin or doxycycline. The complication is cerebral malaria, hyperglycemia, lactic acidosis, liver dysfunction, and also hematological abnormalities.
Next is the prevention measures of Plasmodium falciparum infection. We can use the ABCD principle of malaria prevention. A is for awareness, aware of the risks and signs and symptoms. B for bite prevention, avoid getting bitten by the mosquito, which is from the dusk until dawn. And then C is chemoprophylaxis, which is anti-malaria medication if prescribed by doctor. D is diagnosis, get an early diagnosis for a rapid treatment. And there are some others, prevention, which including by using the back net, wearing a long sleeve, use the mosquito repellent, and vector control of the larvae. Next.
The conclusion, Plasmodium falciparum is a unicellular protozoan parasite of humans and the least species of Plasmodium that cause malaria in humans. The parasite is transmitted through the bite of female Anopheles mosquito and cause the disease most dangerous form, Falciparum malaria, and Plasmodium falciparum assumes several different forms during its life cycle. The sporozoite grow, multiply in the liver to become merozoite. This merozoite invade the RBC to form thrombozoite, schizoid, and gametocyte. And the treatment is use of chloroquine, sulfadoxine, pyrimethamine, and also the doxycycline. Prevention of malaria, like use a repellent and use a flying insect spray to kill the mosquito, and also wear the protective clothing. This is the reference